Welcome back to another edition of our Metabolic Health Summit preview interview. So the Metabolic Health Summit conference coming in Santa Barbara, May 5th through 8th. It's going to be an amazing collection of speakers and attendees. And our preview interview today is with Dr. Kwadwo Kyeremanteng. Now, Kwadwo, he was on the Diet Doctor podcast on episode number 55 back in September of 2020. I highly recommend going back to listen to that. Kwadwo is an ICU doc, so he sees the sickest of the sick in the intensive care unit. And lately, that's been all about COVID, right? That's all people have been talking about. And he's also the director of the ICU at the University of Ottawa. So a big job trying to organize everything with the ICU and their COVID response. But more important than that, at least I shouldn't say more important, but interestingly for him, is that he also focuses on the prevention, how to stay out of the ICU, specifically with COVID, and how that relates to metabolic health. He's got his own podcast, Solving Healthcare Podcast. I highly recommend you go listen to that if you're interested in any of his COVID information and the prevention and the connection between COVID and metabolic health. He also talks about Solving Wellness, which is a venture specifically for physicians and clinicians that he's launched. And he's a big hockey Oilers fan, which gets me excited. So let's get into the interview with Kwadwo Kyeremanteng. Well, Kwadwo, welcome back. It's so great to be able to sit down and talk to you again.
Brett, this is super exciting. It's been a while. It's been, I feel like over maybe a year and a half here, and a lot has changed, but it's always great to connect with you,
I was
friend.
thinking about this interview and I was like, I miss that guy's energy. I miss your energy and your passion. So it was so great to talk to you now. And of course, leading up to the Metabolic Health Summit, May 5th through the 8th, where you're going to be one of the speakers. And that's why I wanted to sit down and talk to you now as sort of like a preview, give people a little bit of preview of what's going on, because it's such an important topic, right? Here you are, ICU doc, seeing the sickest of the sick patients with COVID. You've got a different perspective than a lot of us, and you're really outspoken about the connection between COVID and metabolic health. So give us a little bit about your thoughts on this and how it sort of evolved over time as well.
Yeah, thanks for this, Brett, because it's something I feel really passionate about because, as a guy that was seeing COVID firsthand, I was there for our very first COVID patient at one of our hospitals in the ICU. We were petrified. We were like, are we gonna pass it along? Are we gonna get it? Our family safe? All these questions. And then, we started see specific patterns through patients. They were older, they may have been immunocompromised or have a poor immune system. But then what was very clear was that they often had poor metabolic health. They had type 2 diabetes, obesity, high blood pressure, dyslipidemia, and so when you're seeing this pattern, you're like, man, shouldn't we be telling people this? Shouldn't we be talking about what the value is of improving your metabolic health when we're seeing this front line? And I'll tell you, Brett, too, like, I know this might go without saying, but people that go through a COVID admission into the intensive care unit, this is horrible to watch. You can't breathe. You're having difficulties with your cognition. You need to have a breathing tube put in, a feeding tube put in, and you're away from your family because at the time all these rules in terms of who's allowed in the hospital, and so you're seeing people struggle and unfortunately die from this. And so you ask yourself, what can we do more? And it was great. We brought the vaccines, which has been a godsend. All the public health measures that that has worked to keep us all safe. But at a high level, you got to ask yourself, what would happen if we, on top of everything else, we really promoted what the impact of improving our metabolic health collectively would have looked like? And just, that excitement, that energy of, hey, let's get outside. Let's start moving. Let's think about what we eat. Let's avoid the processed foods and just nudge each other and say, this is what we're seeing. And for those that, maybe you're not going to make a drastic lifestyle change, but there's going to be some of you that do that. And, and when you think about not only your risk to COVID, but your, cardiovascular risks, your cancer risk, all these things, mental health even could be dramatically impacted if we pivot. But so that was a real driver, and you weren't hearing many of us talk
Yeah.
about this
And
stuff.
I think that's the key, that there weren't many people talking about it, but there were some. So on the one hand, it's sort of, I agree with you. It's like a tremendous missed opportunity that it wasn't first and foremost. But it's not like the opportunity has gone away and you continue to be so vocal about it. Are you starting to see a little more traction about it, that there's still this spotlight that we can shine and turn it up a little brighter about the connection of metabolic health and COVID?
I do think I do think there's being more and more light being shone on this. Like, there were studies early in the pandemic linking to metabolic syndrome and poor COVID outcomes, and we're getting more and more data to support that. There was a lot of fear of bringing these topics up because of fat
Right.
shaming and term and concepts like that, and so I mean, I'll be upfront with y'all. At the beginning of the pandemic, there's certain things that you couldn't mention. It wasn't safe in a lot of ways to bring up specific topics, and so there was that kind of fear of being canceled in a lot of ways that I think prevented a lot of docs and healthcare providers and researchers to be upfront about specific topics. But man, yeah, I think there is a bit of a momentum in terms of people willing to talk about the value of improving in metabolic health. And this is something that we should take advantage of the energy. Like we're in a stage, like I'll timestamp this, we're doing this in early February. There's a momentum of exiting the pandemic, and getting into that endemic phase, and part of that energy would be, to me, thinking about
Yeah.
healthy living. Like, what, this is still an opportunity to say, hey, we've been at home, we've been less social. This is the time to think about all these concepts that are going to make us holistically
Yeah.
healthier.
Yeah. In a way, I think sort of the worst thing we can do is say, okay, we've got our vaccines. It's now more of an endemic situation. It's past us. We don't have to think about it anymore. Instead of thinking about, it still exists. Something like this is going to happen again. How do we prepare for it? And number one is, as your message is saying, improve your metabolic health is probably the number one way to prepare for it. And so you've taken some actions to sort of help this. I mean, I've seen you've been doing virtual exercise classes and you've been trying to engage the community. What's sort of the feedback you've been getting for some of those activities?
Oh, this has been one of my favorite things, Brett. It's just like, it's one thing to talk about the concepts, but we want to see some
Yeah.
action, and we started a platform focused on healthcare providers called Solve and Wellness, mostly driven by the burnout we were seeing amongst healthcare
Right.
providers, but also we know how improving your overall metabolic health, how your can translate into just feeling better in general, and so it's been fun. I did some got a level 1 training in CrossFit. I've actually never set foot in a CrossFit gym before that, but I thought I'd get some of the foundation down. Um, and just we it's a platform where we do online workouts, we do yoga, mindful meditation, and then nutrition tips. So we've had low carb, keto, um, intermittent fasting, topics like as such, to be able to bring this up with our members, and it's been really rewarding because it's like a community. We're all trying to support each other, and there's some success stories there. I think of one of the nurses that lost about 20 pounds. Was also kind of you know seeing what we were seeing as frontline staff in terms of risk of metabolic health and COVID, but also that was a big push for her to get healthy. And but yeah, I love it. I mean, like, if you could, the thing, Brett, is like so I do some research on on resource utilization, and so it's when you look at critical care, it's very expensive, the care people
Right.
receive in ICU. It's about 1% of US gross domestic product, and the number one way to really take a bite out of that is preventing people from landing in ICU. Like, really, and this is what I get excited about, because these steps that we're talking about is really pointing towards how you can live a better, like a healthier life, preventing yourself from landing in hospital, and seeing someone like me, where it's a huge uphill battle. And so, yeah, this has been a huge driver, and it's been a lot of fun uh, being part of whether it's at exercises, interviewing the right people, uh, cooking classes, all that has
Yeah.
been
Yeah.
amazing.
I mean, your podcast has done a fantastic job of getting all this information out there. So I highly recommend anybody who hasn't listened to it going to the Solving Healthcare podcast for sure. And it's great to see someone who's an ICU doc. I mean, I think it's, from my experience, it's rare to see an ICU doc talking about prevention as well, because usually you're sort of head down, busy as can be, just dealing with the sickest of the sick and not really thinking about what got them there. So that's what I think really separates you from the pack and is so important, because you have that experience. And I mean, look, you talked about the people who died from COVID, but what about those who survived? It's not like they go back home and just go back to their lives, right? They've got a crazy uphill battle
Mhm.
for them as well.
Oh yeah, it's a great point, and I want to actually piggyback that, Brett, about like even those that are on the healthier side that land in hospital, COVID or not COVID. I must say, one reassuring thing that I saw throughout the pandemic, I don't think I took care of one quote unquote healthy person in the ICU. Like it really was it did discriminate in that way. But when you have somebody in ICU in general that is metabolically sound, is takes their, that as exercise and is physically fit, man, the recovery is
Mm,
completely different than people that don't have that baseline function. It's incredible. Like these are the guys that get home as opposed to end up in a
right.
nursing home or months and months and months in a rehabilitation facility. But yeah, the patients, unfortunately, even if you do survive a COVID experience, like when you in ICU, is it's there is a significant amount of disability, like from your breathing, from your strength, your cognition, your mood, depression, anxiety. So yeah, like this is like we truly do mean it when we want to prevent you from landing in hospital. And I do think you're right, Brett, too. Like not many of us are talking about prevention, and I wasn't one to think about this at all, really. But I think is where the research led me there, like thinking outside the box of, how do you save healthcare dollars where we could utilize those resources in more efficient ways. and and the ultimate answer came to be like, just don't try and prevent people from
Yeah.
getting to you,
Yeah.
and yeah, that was the
Right.
epiphany.
Right. You can try and make the care you get in the ICU less expensive, or even better, prevent them from getting in the ICU in the first place. And that's the best way to do it. Yeah.
100%.
So I want to circle back to something you said earlier, though, about the fear of getting canceled, or the fear of sort of speaking out. That there is this concept of, if you're talking about how it's people who are obese and metabolically unhealthy and maybe living unhealthy lifestyles, it doesn't make it their fault that they got COVID. But at the same time, you can try and prevent it by taking care of these things ahead of time. But if you say that, especially if you say it on a medium like Twitter or some medium where you're bound to be attacked, and it can be sort of polarizing, which seems a little strange, because we're just talking about trying to be healthy and trying to promote the positive. Why is it so often seen as the negative, seen that you're ignoring something, or you're putting people down, or you're blaming people? Why do you think there's that shift in certain and in many circumstances that sort of attack the messenger for that?
Yeah, that's a really good question, and I'm not totally sure. Like sometimes I figure in some of the platforms, like they do want a little bit of animosity to create more um, traction. But I gotta say, a motivator for me was that I honestly believe by having these discussions, you will save lives. Like you will definitely impact and save lives, because all it takes is one. And this is one of the things where I think we were talking about this either on your show or my show, where you have a success story, that family member, that cousin or whatever says, "Oh, Brenda, man, you really improved your metabolic health. You got healthier or whatever. This, how did you
Yeah.
do it?" And that experience is a motivator for those in that circle, and the cycle continues. And I like I said, I truly have used that as a motivator to try and speak up, and I've I must say, I for like mental health, I'm kind of like a when it comes to Twitter, I try and just drop it and not read the comments because they could get pretty sinister with depending on what you're
Yeah.
talking about. But I think the real motivator is that you are gonna it's gonna be a net positive, and so and at the end of the day, you just want to be able to look at yourself in the mirror and say, I'm doing the right thing
Yeah,
for me.
such a great point. To be able to share the information in a way that resonates with you and keeps you having integrity and standing up for what you believe in and doing it respectfully and knowing that people are going to respond the way they respond and you can't always control that. Yeah, I think that's a good point.
Yeah, and it absolutely, and it's just I think this is something that, and I'm not always good at this, but I want to be an example of us just rising up against like these fear narratives, like of being canceled. It's like I am going to do the right thing
Yeah.
because it's the right thing. That's the story. That's the value, and more people will be able to be more courageous to say, "Hey, look at Dr. K threw down and was kept the integrity, kept it civil, kept it about the data, not putting judgment out there." And you could say, oh, this is he's trying to do this, like fat shame, blah blah blah. I'm like, no, I'm not trying to fat shame. I'm just trying to let you know what this is all about, and I'm not going to be deterred because of these negative comments. And I think if more of us have that kind of approach and that attitude, more truth
Yeah.
telling comes out, and we're that much more further ahead when it comes to progress. So
Yeah.
um not to say it's easy, but it's that's my
Right. Right.
roadmap.
I like that. I think that's a great roadmap. And yeah, it's not easy, but it's important to stick to what you believe in. Um, well, so one of the main differences between just get your shot and you're fine, and then you get your free donuts when you get your shot from that approach versus focus on your metabolic health, focus on your lifestyle, is one is seen as the quick fix and one is seen as the long term fix that's a lot slower. So one of the things that I've seen a lot of your content is, if I can paraphrase it, is sort of like separating the way we look at those at risk, the elderly, and those not at risk, the kids and the healthy folks, and sort of separating it. And you had one quote that said, "We're 2 years into the pandemic. We should be thinking of more creative, targeted ways at reaching populations that will land in the ICU." Sort of talking about the difference between the populations rather than lumping everybody together. So, what are some of those more creative, targeted ways to target that population so that we don't have to have one treatment for the entire population when they're at such different risks?
I is one of my favorite questions to answer because I always push when that the narrative of saying we need to be more restrictive. We need to lock down more. I always ask whoever it might be, that academic or whomever, is like, how do we exit this thing then? How is this sustainable? And we put people on the moon. We do have all these creative ways of having these solutions to problems. Where's our creativity here? So in my opinion, it's all about reverse engineering. Who lands in hospital, who lands in ICU, and how do we make sure they get treatment? So, for example, we're seeing a lot of elderly folks right now. We're seeing a lot of organ transplant patients. So make sure that they've had, some of them, the third dose. Some of them, they are actually even entitled for a fourth dose in Ontario. Make sure they have that. Make sure they have quick access to testing. Make sure they have readily available access to therapeutics such as monoclonal antibodies, oral antivirals such as Paxlovid. There's fluvoxamine, an antidepressant that's shown to be effective at reducing hospitalizations. And then the fifth one is budesonide. It's an oral steroid that has had mixed results, like not quality studies, but relatively benign medication that could potentially prevent someone from landing in hospital. Make sure that we are intervening. We have resources so that, hey, you guys that are high risk, if you're a community that is showing signals of being high risk, we bring the vaccines to you. We bring the therapeutics. We make it easy. You know what I mean? You mail to your renal transplant patients a rapid test and potentially, like, if like, I'm not saying to do this, but just in terms of creativity, maybe they do have a quick referral or a phone call that they make to make sure that they have access to monoclonal antibodies. Boom. Like, interventions that have worked to reducing the risk of being hospitalized. And so instead of thinking about closing down a gym, closing down schools, things that are preventing that are essentially so important to being uh, a human being, education, physical health, all this stuff. Let's not shut that down, but let's focus on who's at risk. And and this is in the context of such a well vaccinated society. Like right now in Ontario, I think we're at 90% vaccination, which to me has been fantastic. Everyone has done their part as best we can. There's always going to be, you're never going to get 100% vaccination, but people have stepped up and done their part. And so now that they've stepped up, let's provide them with hope. Let's provide them with a message on why we could move past this, and really think about, once again, that angle of creativity, that angle of intervening, and less on that restriction angle.
Yeah. Great insight. Well, Kwadwo, it's been great connecting with you. And my friend, you do not disappoint with your energy and your enthusiasm. I can't wait to see you in Santa Barbara at the Metabolic Health Summit. And we're going to hang out. We're going to talk about Oilers hockey. And we're going to just, it's going to be great. So thank you for all you do.
Oh, I'm so excited. Thank you so much for having me. And you keep up the hustle, my friend. It's been really inspiring hearing the show for this long, and the guests. And actually, I've pawned a couple guests off you. Tony Hampton, for example. He's coming on the show. Yeah, so I really, really appreciate all the
All right,
great
thanks.
work
I'll see you
doing.
soon.